Are you worried your liver might not be functioning well? Are you experiencing persistent yellowing of the skin or sudden weight loss? These are just a few of the 15 warning signs that your liver may be in trouble. Join us as we dive into the red flags that might signal a problem with your liver and what you can do about it. As we age, our bodies go through various changes, and our organs, including the liver, are no exception. The liver is a vital organ responsible for processing and detoxifying the substances we consume, producing essential proteins and storing energy for when we need it. In our golden years, our liver's resilience can wane, making it more susceptible to various liver diseases. Here are some signs that you might have an undiagnosed liver disease. Jaundice, with its telltale yellowing of the skin and eyes, is an unmistakable sign that your liver might be facing challenges. This discoloration occurs when your liver fails to effectively process bilirubin, a waste product from the breakdown of old red blood cells. Normally, bilirubin is excreted through bile into your intestines, but liver disease can disrupt this process. Beyond its visual impact, jaundice can bring about other discomforts. It often accompanies itchiness, fatigue, and a sense of general malaise. In severe cases, jaundice can even lead to confusion and cognitive issues, as bilirubin buildup affects brain function. Have you noticed a persistent discomfort or swelling in your abdomen? Well, this could be your liver's way of letting you know something's not quite right. Liver diseases can manifest as abdominal pain and swelling. This discomfort arises primarily due to liver inflammation or enlargement, which puts pressure on surrounding organs and tissues. The pain may range from a dull ache to sharp stabbing sensations, and it's often located in the upper right part of your abdomen. Have you noticed your legs and ankles swelling more than usual? Swelling in the legs and ankles, medically known as peripheral edema, can also be a sign of liver dysfunction. The liver plays a vital role in regulating the balance of fluids in your body. When it struggles to do so, excess fluid can accumulate in the lower extremities, causing noticeable swelling. This swelling not only affects your physical comfort, but also your mobility. Walking may become more challenging, and you may need to adjust your wardrobe to accommodate the increased size of your legs and ankles. Another often overlooked symptom of liver disease is itchy skin. When your liver isn't doing its job properly, toxins can accumulate in your bloodstream. This buildup can lead to a relentless itch that can interfere with daily life. So if you find yourself reaching for the itch cream more often than before, it's time to pay attention to your liver. Let's talk about something you might have noticed in the bathroom: the color of your urine. If it's taken on a darker hue, it's like a visual cue from your body that something's amiss. Normally, your liver helps break down bilirubin and excretes it through your urine, giving it a light, straw-like color. When your liver falters, it can't process bilirubin effectively, leading to that darker, amber-colored urine you're seeing. On the flip side, pale-colored stool can also signal liver issues. Your liver plays a crucial role in giving your stool its characteristic brown color by releasing bilirubin into your intestines. When your liver isn't up to the task, your stool may become lighter in color, almost clay-like in appearance. Feeling tired all the time? Well, that's another subtle signal from your body that your liver might need some TLC. Chronic fatigue is a common yet often underestimated symptom of liver disease in older adults. Your liver is responsible for storing and releasing energy, among other crucial functions. When it's compromised, you may experience persistent tiredness. This fatigue can be debilitating and significantly impact your quality of life. It may affect your ability to engage in daily activities and enjoy your hobbies. It's as if your body's battery isn't holding a charge like it once did. Nausea and vomiting can be quite unpleasant and can take a toll on your daily life, but they're not always related to something you ate. They can result from liver disease, particularly when the liver struggles to detoxify the bloodstream effectively. The accumulation of toxins can lead to feelings of nausea and, in some cases, episodes of vomiting. These symptoms can be distressing and interfere with your ability to eat and maintain proper nutrition. Well, this isn't a telltale sign, and there can be other causes of your nausea and vomiting. Liver disease is one that can lead to persistent nausea and vomiting. Have you found that your appetite has diminished recently? Well, it's important not to ignore this sign. A diminished appetite is another subtle yet crucial sign of liver disease. Your liver produces chemicals that aid in digestion and appetite regulation. When liver function is compromised, as seen in conditions like cirrhosis, you may lose interest in eating and struggle to consume enough nutrients. It's as if your hunger button has been turned down. A persistent loss of appetite can lead to malnutrition and further exacerbate liver issues. It's like a vicious cycle that leads from one problem to the next. Loss of appetite can eventually lead you to unintentionally lose weight. If you've been losing weight without trying, your liver could be sending a signal. The liver plays a role in processing nutrients and storing energy. When it's not functioning well due to disease, it can disrupt your body's ability to maintain a healthy weight. So if the scale shows a significant drop in pounds without changes to your diet or activity level, it's time to talk to a doctor. Feeling more confused or forgetful than usual? This can also be a sign of liver disease. This is because your liver plays a role in filtering out toxins that can affect your brain. When it's overwhelmed, these toxins can affect your brain, leading to difficulty concentrating. Now here's something you might find unusual: spider-like blood vessels on your skin. These are known as spider angiomas, and they can be a sign of liver disease. These little red dots resemble spider legs and typically appear on the upper body, face, and neck. When your liver isn't doing its job properly, it can cause changes in your blood vessels, making them more visible. They occur when blood vessels near the skin surface become dilated due to liver-related changes. Remember that bloating we talked about earlier? Well, it can progress to something more severe called ascites. Ascites is the accumulation of fluid in the abdominal cavity, and it can cause significant discomfort and swelling. This occurs when your liver is struggling and it can't maintain the proper balance of fluids in your body. This is often a sign of advanced liver disease and should be taken seriously. Here's something you might not expect: changes in your breath and body odor. Liver disease can cause your breath to take on a sweet, fruity, or even musty smell. The liver helps break down waste products and toxins in your body. When it's not working properly, these substances can build up and lead to unpleasant odors. So if you've been dealing with persistent bad breath or an odd body smell that doesn't go away with good hygiene, it's worth discussing with a healthcare provider. Lastly, let's talk about those unexplained bruises that seem to appear more often than they used to. As we age, our skin naturally becomes more delicate, but liver disease can exacerbate this vulnerability. The liver produces essential proteins involved in blood clotting. When liver function declines, these clotting proteins may be produced in insufficient quantities, making you more prone to bruising even from minor bumps and knocks. If you're noticing bruises more often than usual, it could be due to your liver struggling to produce essential blood clotting proteins. Now that we've explored these subtle signs of liver disease, it's only natural to wonder, what causes different types of liver disease? Let's delve into the causes. After all, understanding the why can be just as important as recognizing the what. Sometimes it's those tiny invaders called viruses that can wreak havoc on our liver. You might have heard of hepatitis A, B, and C. These are all diseases caused by viral infections. Your liver can be quite resilient, but these viruses can push it to its limits. Similarly, our immune system, which usually protects us, can sometimes get a little confused and start attacking our liver. This mix-up results in autoimmune liver diseases. Primary biliary cholangitis and autoimmune hepatitis are two examples. It's as if your body's defenses accidentally target the wrong team. Unfortunately, sometimes it's in our genes. Inherited liver diseases like Wilson disease and hemochromatosis develop because of a genetic condition passed down from our parents. Cancer can also affect our liver. Abnormal cell growth can lead to tumors in the liver. These tumors can be either benign or malignant. It's essential to keep an eye on this possibility. Lastly, our lifestyle choices play a significant role. Alcohol-related fatty liver disease is directly linked to excessive alcohol use. Then there's non-alcohol-related fatty liver disease, NAFLD, which is on the rise due to increasing rates of obesity and diabetes. Alright, we've got the signs and causes, but what's the next step if you suspect you may have liver disease? Let's talk about managing and treating it. The treatment for liver disease isn't one size fits all. It depends on the type and how advanced it is. Here are some possible treatments. Some liver diseases can be managed with medications. For instance, viral infections like hepatitis or inherited conditions like Wilson disease might require specific medications. However, sometimes the solution is closer to home, in your daily choices. If you have fatty liver disease, adjusting your diet can work wonders. For example, avoiding alcohol, limiting fat and calories, and increasing fiber intake can make a significant difference. Alcohol-related liver disease can improve dramatically with abstinence from alcohol. Your liver appreciates it. In severe cases where liver disease progresses to liver failure, a liver transplant may be the best option. It's like a fresh start, as a healthy liver replaces the one that's been struggling. Now, the million-dollar question: can liver disease be prevented? The good news is, for some types, the answer is yes. If you're concerned about liver health, consider cutting back or eliminating alcohol from your life. Also, be mindful of what you put into your body. Steer clear of foods and drinks loaded with trans fats or high fructose corn syrup. While you're at it, consider cutting back on red meat as well. A balanced diet is key to a healthy liver. As we age, we tend to take a lot of medications. If you're taking prescription or over-the-counter medications, be cautious. Some can be tough on your liver, like acetaminophen, Tylenol. Always follow your doctor's advice when it comes to medications. One of the best ways to prevent liver diseases is regular exercise. Regular exercise isn't just good for your waistline, it's beneficial for your liver too. It helps keep everything running smoothly.